Makers say they cannot do it alone. They're going to need Republican votes to push President Obama's ambitious health care overhaul through. But some GOP members do not see what the rush is. And among those is this gentleman who has been outspoken on the topic, Republican Senator Jim DeMint. He is the chairman of the Conservative Senate Steering Committee. He's also the author of the new book, Saving Freedom: We Can Stop America's Slide into Socialism. Senator DeMint, welcome. Good to have you with us today.
Thanks, Martha.
So talk to me a little bit about where things stand now. You've got this group of six Republicans and Democratic senators in the Finance Committee who are trying to hammer something out here. Are you at all encouraged today? Can you tell us anything new on the progress that's happening there?
Well, the thing I'm most encouraged about is the American people seem to be saying very clearly that they want health reform but not a government takeover. And I think if we could agree on that principle, we could get a resolution relatively quickly. But so far, we don't see any of our Democrat colleagues who are willing to do the things that would encourage interstate competition of insurance companies or things that would help individuals who don't get their insurance at work buy health insurance. We need to continue to sort this out, but at least we're having a good public debate about the issue now.
Now, I want to talk about a couple of the specifics that you just touched on, and one is interstate commerce. So what, I think a lot of people listen to that and say, why can't you shop out of state to get your health insurance policy? Or if you're a company and you get a better deal in Tennessee than you do in New Jersey, why shouldn't you be able to do that? What is it that you're hearing from your Democratic colleagues? What is it they don't like about that?
Well, I actually brought this up as an amendment to a bill when Barack Obama was in the Senate. He voted against it. They spoke out against it as Democrats because they thought it was a race to the bottom, that if I wanted to buy a policy in Arizona that was what I wanted, and maybe it's a high deductible policy, the Democrats don't think I should be able to buy a high deductible policy. But the fact is, if we had interstate competition between insurance companies, the prices would go down, the quality would go up. We know that. But they're instead saying, in order to get competition, we need a government plan. That makes no sense at all.
All right, so you're saying open it up to states. Do you think there's any movement on that issue at all from the Democratic side? Is that a deal breaker?
Yeah, I don't think they want the individual market to work, Martha. I mean, they voted against allowing individuals to deduct the cost of insurance from their taxes when they don't get it at work. I mean, that's just fair treatment to people who don't get insurance at work. And the several other things they voted against small business health plans. So the point is clear to me, working with Democrats over the years. Yeah, they want government to take over health care. They don't want the personal insurance market to work.
What about this public option? There has been some indication, at least in some of the reports coming out, that the public option may be negotiable, that perhaps that could be, sort of backburnered for the time being. Do you see that happening?
Well, that's a positive step, but I'm afraid it's a wolf in sheep's clothing at this point, because then they turn around and say that they're going to mandate all of these requirements, including abortion and other things, on every other insurance policy, which means the private insurance companies would, in effect, have to carry a government plan. We don't need all of this. I was in small business myself for years. I also worked with hospitals and physicians for years. There's some good, not simple, but easier answers that don't require a government takeover.
You said over a week ago that you thought this might be the president's Waterloo, and that if Republicans hung tough on this issue, that it would, quote, break him. What do you think about that now? In terms of public opinion and the polls, what do you think about that now, Senator?
Well, this is not personal, and I like the president very much. This is about his policy. If we can stop this policy, this government takeover, then the president maybe will come to the table and work with us on other issues. If not, he's going to rush right through health care to cap and trade, electricity taxes, and other things on his agenda. We've got to get this president to slow down and listen to the American people. We can't allow him to socialize health care when there are better options available that are proven options that I think the American people would prefer.
All right, Senator DeMint, thank you very much for your time today. Good to have you here.
Thank you.
And fair and balanced as always, we are getting the